Good afternoon. My name is Nick Miller. I'm a board member with the Sacramento Press Club, and we're inviting you to our luncheon conversation today. It's sponsored by HealthNet, and we have a very special guest, Dr. Anthony Fauci, is joining us from Washington. As many of you know, he's the director of the National Institute of Allergy and Infectious Diseases. He's also one of the lead members of the White House Coronavirus Task Force. And he's going to be interviewed today by Sami Kayola. Sami is a healthcare reporter with Cap Radio, which is the NPR station in Sacramento, California. Sami, Dr. Fauci, welcome.
Thank you. It's good to be with you.
Dr. Fauci, thank you so much for joining us today. As you know, here in California, Governor Gavin Newsom issued stay-at-home orders early on and recently started the process of reopening the economy. Where do you think our approach has succeeded, and how has it fallen short compared to other states that you've looked at?
Well, I think, as you know, the governor has really been ahead of the curve in doing what he did to save California from having worse of a situation than they have compared to other large states and important states in the country. One of the things that I think is really important is that as you start to open up and follow what you call the guidelines for opening America again, which I'm sure many of your listeners are familiar with, you have to start off by passing a gateway checkpoint. And if you succeed, you go to phase 1. If you succeed, you'll go to phase 2, and then ultimately phase 3. Each of those have some restrictions. The thing I'm concerned about, I think that from the leadership that I'm seeing, it's being done correctly, but there's a difference of when you open up, namely following the guidelines, and what the people of California do in response to that. What we're seeing in some states that are having difficulty is that a leader, that leader might be a governor or a mayor, says, okay, here's what we're going to do. We're going to follow these guidelines. And particularly young people, because if you look at the people right now who are getting infected, if you look at the curve of the country, you have cities and metropolitan areas like New York going way down, and then you have others where the cases are coming up. And that's the reason why the curve of the country is flat, if not going up a bit, when it should be really going down. So what is happening as locations, be they whole states or cities or counties, open up, we're seeing a disconnect between what are the restrictions, guidelines for slowly taking the next step, being jumped over by many people, usually young people, who think that now that we're opening means all or none, black or white, either no restrictions or lockdown. There's a big difference between the two. And what we're seeing when you see on the radio, see on TV or in actual still pictures, people congregating without masks, even in a state or a city that is in a phase when they still should be doing some social distancing. They still should be wearing masks, and they're not. So I don't think it's anything that the state of California is doing wrong or not. It's what the response of the people are to what the opening process is.
Right. And unfortunately, since we started lifting restrictions on businesses, we are seeing an uptick in hospitalizations. Now, Governor Newsom actually said earlier this morning that he isn't planning to shut down the economy at this point. But do you think either now or looking toward the fall that we should be considering reclosing certain sectors or even the state? Why or why not?
I leave that. I've dealt with I dealt with Gavin Newsom a fair amount, and be that on governor's calls or in person. He's got a really good sense of what's to do. So I'm not going to recommend it, except that in many respects I agree with him. You don't really need to go back to lockdown. You need to pause and say, wait a minute, we're starting to opening and things aren't going right. What do we need to do to correct that? Now, you may need to stay where you are and impose a few more restrictions, or maybe back up a little. But again, just like you don't want to open in an all or none, you don't want to start locking down completely, because ultimately that's always a possibility. but I wouldn't be saying that right now. Getting back to what I said before, I really do think we need to emphasize that. And it's not that you're blaming young people. I mean, that's going nowhere. What you're saying is that it's totally understandable, the urge to get back as quickly as you can to what you perceive as normal in your life. And I know when I was at that age, what normal would be, you work hard and you have a lot of fun. That's what life is all about. But the interesting thing is, although you think you may not be as vulnerable to the serious consequences of getting infected, well, you could say, well, if I get infected, who cares? Most of the young people do real well, and it's no big deal. But you've got to realize that you're part of a dynamic pandemic process. So you're getting infected, even though you don't realize it, is propagating the continuance of the outbreak. Because when you get infected, even if you're without symptoms, or even if you have mild symptoms, the chances are strong that you're going to infect somebody else, who will infect somebody else, who then will infect the vulnerable person. A grandmother, a grandfather, an uncle or a cousin who has leukemia and is on chemotherapy. That's how your responsibility is not just individual. There really is a societal responsibility there.
Absolutely. And thank you for emphasizing that. It's such an important message for people to hear right now. I'd talk a little more about face coverings. Our statewide health orders ask people to wear them, but we're seeing lots of people are not doing that. What sorts of messaging can elected officials or public health officials put out to get people to comply?
Well, that's why I'm here on your show with you, is to really do exactly that. There's no doubt. I mean, I think there was some confusion about masks in the beginning, and it's unfortunate it gave a mixed message. It was at a time when personal protective equipment, including masks, were in short supply. And it was clear that the people who really needed them were the healthcare workers who bravely put themselves in harm's way at a risk to take care of people with COVID disease. Now we have plenty of masks, and we know that cloth coverings can work as well as some masks. So everybody should wear a mask when out in public. Keep 6 feet distance. Don't congregate. If for one reason or other you are going to congregate, namely you're not listening to me, plan A is don't congregate. Plan B is that if you do congregate, wear a mask and keep the mask on all the time. Because your tendency is when you get animated and you start doing that, you pull the mask down. Don't do that. It really does not only protect you, but protects others in case you might have an infection that you don't even know about.
But face coverings have become a polarizing or political issue. How can we get past that?
There's no secret formula for that except to say, get past it. It should not be a political issue. It is purely a public health issue. Forget the politics, look at the data. It's very clear that when you do meta-analysis of mask wearing versus not in different countries, it makes a difference. It isn't perfect, but you don't want the perfect to be the enemy of the good. There is a significant advantage in protecting yourself from acquisition and protecting others from acquisition, right?
Hospitals here in California are still bracing for a surge, and they expect they will have to maintain capacity for many months to come. What does the U.S. experience over the past few months tell us about how California could better prepare for another pandemic of this scale?
Yeah, what they need to do, and it should be done not only by California, but it should be done at the national level. And that is even in areas where there is a diminution of infection and diminution of hospitalization, we still need to build up the stockpile. The stockpile in the beginning was not adequate to really address the major surges we were seeing, particularly in the northeastern part of the country, in the New York metropolitan area. But right now we have some time. I mean, we're not where we want to be because we want to see that curve come way down. It hasn't come down. If you look at it, it's in every newspaper you read. almost everyone has somewhere in the newspaper, you have that chart that shows where the rate of infection is. Yesterday, we had something like 35 or 37,000 new cases of coronavirus disease, new cases. Remember, there was a talk that we started off at 30, we went down to 25 and then 20, and everybody was very happy that it was coming down in the right direction. Now it's not, it's going back up.
Right. So California hospitals, if they've been able to maintain the capacity that they originally built up, what will happen to them if we do see a surge? And will they have another backup after that? Or how can they create one?
We hope not. That's the reason why I think it's time to start preparing. Each state, I mean, the one thing I've learned not to do is that you don't go in and telling people what they should do. I have found that when you lead, first of all, you set the general principles. And I think by your question, you've already set the general principles. We have the possibility of a surge of cases. Do we have enough backup to handle them? If we don't, let's start building it up. And I leave to the creativity of the people in your state. Your governor for sure has that. Your mayors, who clearly have that, your health officials, of knowing what to do, is that don't wait for it to happen. Start doing it now.
Thank you. Thank you for answering that question so eloquently. People of color are experiencing the highest death rates from COVID-19 across the US. This is a huge concern here in California. What can be done to prevent spread in these communities and to reverse the underlying health disparities that make some groups more vulnerable to this virus?
Okay, so question one is an immediate solution. Question two is a decades-long solution. Okay, so what you do is you concentrate resources in those areas where demographically you have a concentration of the vulnerable from the standpoint of ethnicity, race. African Americans, Latinx, clearly Native Americans, clearly because of a number of reasons, immediately have a higher risk of infection because they have a disproportionate number of jobs that are so-called essential, where they're outside, not being able to separate themselves, interacting with people. So their risk of getting infected already is higher than the general population. Then when they do get infected, they have your second issue, namely they have underlying conditions that are caused by the social determinants of health that have been around for such a long time. They have higher degrees of hypertension. They have higher degrees of diabetes. They have higher degrees of obesity. You've got to address that in the immediate and long run. But for the immediate time, make sure there are the resources and the healthcare availability so that you could diagnose, identify, contact trace, and get people who are at risk because of their demographic group into the appropriate care as quickly as possible.
So you're talking about creating testing sites in underserved neighborhoods.
Absolutely. Concentrate those resources where they are.
Right. How far will that take us in being able to treat people when they have it or prevent them from spreading it to others?
Well, you're not going to turn around the healthcare delivery system overnight for sure, because there's systemic difficulties with that. But to the extent possible, try and get accessibility to healthcare in those areas that are now vulnerable. We know what we need to do a year, 2, 3, 4 years from now. But right now, you've got to address that vulnerability.
Absolutely. So I want to talk about the moment that we're in. You have been saying that the next few weeks are going to be crucial, especially for Sunbelt states such as Texas and Arizona and Florida. Is California in that position? How crucial are the next few weeks for us?
I think it is. I don't think it's as dramatic and as Florida is right now, because if you look at Florida, Florida has just gotten a lot of new cases. I think California is starting to see little bits of surges at the community level as they're opening up. I think if you're not, and I say if you're not careful, I know you're going to be. I think that from the administrative standpoint, that you have a good handle on what things to do. Getting back to what I started off in the beginning of the interview, Sammy, I know we've got to get the population to realize that we're all in this together. It is not, I'm taking care of myself. I don't really care about you. But what you do will have an impact on others. You know, and Californians have risen to the occasion on social issues so well in the past. You've been the leaders in the country on those things. This is an issue that really has social responsibility associated with it.
Yeah, well, thank you for the compliment on behalf of California. We will try to keep doing you proud. I want to ask one more question about skilled nursing facilities and senior homes. This is an area where we've seen some major outbreaks, and it's one of the hardest environments to control. What guidance can you give California on how to protect the vulnerable seniors that live in these congregate settings?
Yeah, that's a great question. You know, one of the things we've learned from when there have been outbreaks in facilities that are generally confined facilities, you know, be they prisons, be they cruise ships, naval vessels, nursing homes, is that often, you know, you could test everybody in the facility once and then say, we know that the people there are at least baseline not infected, and then intermittently screen them. But importantly, do not expose them to people who might be at high risk, so that when you have the staff that take care of people in these facilities, make sure they very, very strictly follow infection control. Masks, frequent hand washing, availability of non-sink Purell type things wherever they go in, washing hands when you go into a room, when you come out of a room, keep your mask on at all time, because often it's an outside innocent person that brings an infection into a facility like an extended care facility, and then it spreads like wildfire. That's one of the recommendations I think that's really important.
Thank you. And one of the problems that we're seeing a lot, and I'm hearing this from county health officers, is that now that businesses are open, people are starting to get together again, you know, family gatherings, birthday parties, barbecues, and that's where a lot of our contact tracing is showing the cases are popping up.
Right.
What messaging can we give to discourage people from gathering in that way?
Yeah, you know, I do that, Sammy, and then, you know, I'm the Grinch that stole fun, the anti-fun guy. You know, I think it gets back to the original message that we were saying. It's so understandable, the urge and the need to get back to normal, especially since a lot of that centers around socialization with the people you care about. I mean, that's such a natural instinct in life. Unfortunately, we have to put that aside a bit and realize that if the particular guideline that you are in right now says avoid congregation, keep 6 foot, you got to try to the best of your ability to have your social interactions in a modified way. It gets back to what I said in the beginning of the interview. It's not all or none. It's not lockdown or caution to the wind. There is an intermediate in there, and that's what we've got to do. We've got to do the fundamental basics. And you mentioned it before. Masks are important, social distancing. And there's so many creative ways to do that. You know, you could have people over who you can keep 6 feet apart, masks on as you're talking. When you eat, obviously, you got to take your mask off. But that decreases the risk a lot if you do some sort of mitigation of risk by the kind of physical distancing without necessarily shutting off all social interaction.
Right. Who wants to do that? How long can we do that, really?
It's very tough. It's very tough.
Dr. Fauci, what did I not ask you? What would you like to share? What do people need to know?
No, I think you asked all the appropriate and relevant questions, Sammy, but I also think that people need to realize, as difficult as this is for all of us, more than just inconvenience, the terrible toll on the economy, on jobs for people who need to support their family. That's serious business. This will end. but it will end because we will be doing things to make it end. It's not going to end spontaneously. So the things that we're doing that are uncomfortable now because they're restrictive are the very thing that are going to get us to normality. So the good news is that it will end, I promise you. The sobering news is that we got a lot of work to do to get there.
And I believe your time is up, but I am so grateful that you were able to join us for this segment today. And thank you.
My pleasure. I appreciate you giving me the opportunity to chat with you.
Bye, Dr. Fauci.